Hello everyone, myself Shanaz and I welcome you all to my channel Nurses the Heart of Healthcare. If you are new to my channel, please subscribe Nurses the Heart of Healthcare. In this video, we are going to learn about one of the important procedure in a healthcare setting, that is hand hygiene, which is also known as hand washing. And we'll also see how effective and timely hand hygiene plays a crucial role, or it's a cornerstone in prevention and control of infection. So let's start. Hand hygiene. In this video, we'll learn what is hand hygiene, what is the purpose of hand hygiene, what is the importance of hand hygiene, and the 7 steps of hand hygiene that are recommended by WHO. And if we don't perform hand hygiene as per these 7 steps, what happens, and the 5 movements which are recommended by WHO. So let's start. What is hand hygiene? Hand hygiene is nothing but it's an act of cleaning the hands. It's an act of cleaning the hands to remove the dirt, organic matter and the microorganisms from our hands. Okay, so hand hygiene, it's an act of cleaning the hands to remove the dirt, the visible dirt, okay, and the organic matter and the germs from our hands, so that they are safe for providing care to our patients. Okay, so hand hygiene, if we don't perform hand hygiene properly, usually if we do it in a hurry, these are the areas that are most often missed. Okay, these are the areas that are most often missed. The red one, the golden color here and the yellow, these are the areas most often missed if we don't perform hand hygiene properly. What is the importance of hand hygiene is, hand hygiene is one of the effective means of preventing the transmission of healthcare associated infection among the hospitalized patients. Okay, so it is one of the effective way, it is number one way, or I can say it's a great way of preventing the transmission of infection among the hospitalized patients. So that's the reason we have to perform hand hygiene properly. If we don't perform it properly, these are the areas that will be missed. To make sure that all the areas of our hands are thoroughly cleaned, WHO has recommended 7 steps of hand hygiene. Okay, so these are the 7 steps of hand hygiene, as you can see here. The entire procedure of hand hygiene, it takes 60 seconds, and these 7 steps, it takes 20 seconds. Okay, so to assure that our hands are clean for providing patient care, we have to follow these 7 steps. Now, what all we require to perform this procedure? We require a sink with a clean running water tap, okay, and we require a liquid soap, antiseptic liquid soap or a soap, and a single use towel or a tissue to dry our hands. Okay, and what are the 7 steps that are recommended by WHO? The first one is, as you can see here, first we have to wet our hands. Okay, open the tap, then first wet your hands with the running water. Then second, we have to take the liquid soap. As you can see here, we have to take the liquid soap in our hands enough to lather. Then lather it, okay. Then after that, we have to rub both our hands like this. Rub both the palms against each other like this by interlacing the fingers. Okay, then next step is, we have to rub the dorsum of the left hand with the right hand like this by interlacing the fingers, and vice versa, the dorsum of the right hand with the left hand by interlacing the fingers. Then next step is, make a cup, and then next we have to clean our knuckles, that is the back of our fingers, against the palm, and vice versa like this. Okay, then the next step is clench your fingers like this, and we have to clean our fingertips we have to rub the fingertips on the palm of the other hand like this in a circular motion. Then the fingertips of the left hand on the palm of right hand in a circular motion like this. Okay, then the next step is, we have to clean the area between the index finger and the thumb in a rotating manner. Okay, again vice versa, clean the area or rub the area between the index finger and the thumb, and rub the thumb in a rotating manner. Okay, then after that, we have to rub our wrist. okay, in this way. And then next, rinse our hands thoroughly with the running water. Then after that, use the towel, the single use towel or a tissue to close the tap, okay. And we have to dry our hands with a single use towel or a tissue, okay. So these are the steps of effective hand washing, and the entire procedure, it takes 60 seconds. So if we perform hand hygiene with these steps, we are making sure that our hands are safe for providing patient care, safe for ourselves as well as safe for the patient. Now next, coming to the 5 movements of hand hygiene for healthcare workers. WHO, World Health Organization, in 2009 introduced 5 movements of hand hygiene for healthcare workers in an attempt to make sure that to prevent the transmission of infection or to reduce the burden of healthcare associated infection, okay. So what are the 5 movements where we have to perform, a healthcare worker have to perform hand hygiene? The first one is before touching the patient, okay, before touching the patient. Then next is before performing any procedure over the patient, any aseptic procedure over the patient. Third is after exposure to the body fluids. Then next is after touching the patient and after touching the patient's surroundings. So these are the 5 movements where the healthcare workers must perform hand hygiene: before touching the patient, before aseptic procedure, before after exposure to the body fluids, after touching the patients, and after touching the patient's surroundings. So these are the 5 movements to ensure or to reduce the burden of healthcare associated infections, okay. Then next, Global Hand Washing Day, which is observed on October 15th, okay. Washing hands saves life. It is safe for ourselves as well as safe for our patients. So safe hands are caring hands. So we have to make sure that our hands are safe for providing care. So if we perform hand hygiene, we have a lot of benefits from that. One is it lowers the risk of diarrhea and the intestinal problems, it prevents eye infections, and it lowers the risk of respiratory infections. So wash your hands and stay safe. So hope this video has helped you in understanding about what is hand hygiene, the purpose, the 7 steps of hand hygiene procedure, and the 5 movements of hand hygiene, and the Global Hand Washing Day, okay. So if this video has helped you, then please subscribe my channel Nurses the Heart of Healthcare, and like and share the videos. Thanks for watching. Stay connected.